with a little bit about CVF. I think you say they were formed in August of 2020. And what was the reason for the formation of CVF?
Yes, that's right. So CVF was formed in August 2020 at a time when shielding had been paused and children were required to be back in school in September 2020. What that meant was that for people who were living within clinically vulnerable families, they were concerned about the risk of their children returning to school and indeed contracting COVID. This is despite the assurances at the time that schools were safe and that children indeed didn't transmit COVID. But Clinically Vulnerable Families was set up by Lara Wong, who was a teacher, and she recognised the risks to parents of children returning to school and indeed clinically vulnerable and clinically extremely vulnerable teachers who were also required to return to school in September 2020.
So pausing there, we understand that the genesis of CVF was because of the concerns about going back to school. Now, you'll appreciate, Dr. Finnis, that we're concentrating on the impact of the pandemic within the healthcare systems. And so that's not to minimise the impact on children, and indeed the teachers who were clinically vulnerable or clinically extremely vulnerable. But can we focus today on healthcare systems impact, if we may?
Yeah, that's absolutely right. So as we understand it, there was an algorithm initially who identified people who should be put on the shielding list. But there were people, because algorithms are never perfect and there's a data quality issue that I think you've heard about within the NHS anyway, some people weren't identified by the algorithm. They were then left thinking, well, you know, I don't appear to have been told that I'm being shielded. And that then led them to contact their general practitioner to ask whether they indeed could be added on. However, that did bring about delays to shielding. And as we'll go on to talk about, probably the benefits of shielding was that you actually had a passport through that shielding letter to enable you to work from home. Yeah. So people who were delayed not being able to do that and who, for example, had frontline jobs, as you've just heard the previous witness say, were required to still go into frontline jobs until they had those letters.
Although there are, I think, the different medical categories, we were also told that if a GP identified a patient as being clinically extremely vulnerable, they could be added to the list, and indeed people could ask themselves to be added to it. And you said that led to delays. Are you able to help us from CVF's perspective how long it took if you were in that latter category of asking your GP to be added?
Well,
days, weeks, months?
Yes, it could take weeks. And that was because the GPs themselves, you know, everything had changed at that time. So it was quite hard actually to sometimes contact your GP. You know, everything was remote. People didn't know really who to contact. You know, everyone was very worried, scared at that time. They knew that they had a vulnerability. The list was publicly available and they thought they should be on it. And so it was a very worrying time for them. They knew they should be on the list. They didn't have a shielding letter. They weren't able to work from home at that time. So their life was potentially at risk. And indeed, being put on the shielding list could then take weeks.
Does CVF have any concerns about the timing of the compilation of the list?
Yeah, very much so. So obviously we were aware, or those of us that were aware, of which many people that had underlying conditions were watching closely the pandemic, because we soon realised that people, sadly, who were dying had underlying conditions. And so we had worked out really that we were at higher risk, and we were obviously watching initially the WHO and the problems in China. And then later, of course, the terrible problems in Italy, and indeed that was being beamed into our front rooms on television, and then, you know, people with these underlying conditions and even telling us what they were, even at that point. It was very late. The shielding timetable, when people were told to shield, seemed very late into March. And indeed, when you look at the timing of the first wave, I think CVF would suggest it was too late, and that in fact some of those clinically extremely vulnerable people could have been told to shield earlier and not have become infected.
What, pre-shielding? Is that
Absolutely, and we've got quite a few teachers actually within our group due to how it was actually set up. And for teachers, it was really difficult. You know, they were in school every day with lots of children. They knew that they had one of these conditions on the list, and they were not told to shield. They were not actually given any information what to do. There was no real education. I think at the time we were being told to wash our hands to happy birthday, as I recall. And that was really all the advice. So it was a really stressful time. I guess the group of people for whom we represent that were able to shield informally the most were older people who were retired. It's again highly disempowering asking your family, friends or neighbours to pick up your prescriptions from a pharmacy. But they're not necessarily people who are used to asking people to do things for them. They were often stalwarts of the community who were doing things for other older people. Many of us have older parents, for example. We wouldn't want to put them in harm's way. And indeed, we weren't necessarily part of those kind of maybe, I would say, older age community groups to support us. So a lot of us were very perplexed by these texts. We didn't really know what to do. We felt really stuck. Many people, we didn't know how to get our prescriptions. And these texts, they make it seem quite sort of easy. You know, you can order repeat prescriptions online on the NHS app. Lots of people didn't have the NHS app at that point. Lots of us weren't plugged into remote pharmacy deliveries at that time because obviously before we could go to the pharmacy and collect our medications on the way home from work, for example. But suddenly we're being told we can't do all of these normal things and we must now ask other people. And that was really problematic for our group. I mean, I just want to talk about the clinically vulnerable if I can here, because I think it's really important because although they were never formally shielded, they were obviously told they were at higher risk. And they too often needed medication, for example, diabetics, asthmatics, needed really life-saving, important medication. They also were sort of advised to obviously ask family and friends, etc. But there was a real problem that developed with the clinically vulnerable, as I understand it from members in our group, who said that, well, you're only clinically vulnerable. You're not clinically extremely vulnerable. You're not shielded. And people started to not want to put themselves in harm's way to help those people.
Thank you for watching Health Bulletin. Don't forget to subscribe for more updates on global health and science.